Welcome to the Interprofessional Space podcast, where the spirit of inquiry meets healthcare collaboration. In our podcast, we discuss all things interprofessional education. According to the World Health Organization, interprofessional education is when students from at least two healthcare professions learn about, from, and with each other to improve health outcomes and enable effective collaboration.
Dr. Jaap Reinders is a Dutch work and organisational psychologist with extensive expertise in interprofessional collaboration research. Since 2000, he has worked at the University Medical Center Groningen, and since 2010 at Hansa University of Applied Sciences as a researcher, lecturer, and coordinator. He developed the extended professional identity theory, a new mid-level psychological theory that explains how interprofessional identity develops and can be strengthened to improve collaboration across professional groups. Dr. Reinders also developed the internationally validated extended professional identity scale and a meta-model of interprofessional development. His work includes designing, implementing, and evaluating interprofessional learning and collaboration interventions, applying both quantitative and qualitative research methods. He holds leadership roles in national and international networks, including IPINN, Interprofessional.global, and NFU IPE Working Group, and serves on editorial boards of interprofessional research journals. Welcome, everyone. We are thrilled today to be joined by Dr. Jaap Reinders, who's going to talk to us about a lot of different things, certainly the extended professional identity theory, but there is a lot to unpack here. We're very excited to have you.
Thank you so much. Thank you.
So I guess, Susie, may I start? I'm going to start. Okay. So do you want to talk to us a little bit about your background for folks who might not be familiar with you?
Okay. Well, I'm a work and organizational psychologist. So many people associate psychology with clinical psychology most of the time, and this is why I'm still remembered of this daily, at least a weekly basis where people ask me about therapy, but I have no expertise with regard to therapy whatsoever. So as work organizational psychologist, I'm interested in performance, I'm interested in collaboration, I'm interested in job satisfaction, maybe even cost effectiveness. So that is my background. I'm from Groningen. That's an old university city in the north of the Netherlands. And I am involved for, a couple of years now, for some years. I'm involved in studying interprofessional identity from a psychological perspective and how this can contribute as one of the puzzle pieces. It's certainly not the only puzzle piece, but it's one of the pieces. And it's not difficult, but it is complex. It is mostly complex. So a lot of things, once you bring them together, this puzzle piece is also compiled of several puzzle pieces. But I work for two universities, two affiliations, and soon I have three, which is also another hospital. I work at the University Medical Center Groningen, which is part of the University of Groningen. And I also work for another university in Groningen. That's the University of Applied Sciences. That's the Hansa University. And soon I will also, partly part-time and temporarily will work for Nijmegen. ECL, that is the expertise center for lymphovascular medicine. And there we're going to focus on interprofessional collaboration and practice.
Fantastic.
So you developed the extended professional identity theory, and that's, I think, what most people are going to know you for, and the toolkit that goes with that. Can you, for those that may not know, which I would hope most people would, but those that don't, can you explain what that is, why you might use that, why it's important?
Yeah, absolutely. It is a mid-level psychological theory. And it's different from other theories because it's not fundamental. It's a mid-level theory. Fundamental theories of identity, for instance, are social identity theory of Teifel from 1979, which explains how people, what kind of intergroup behaviors, how people behave, in-group, out-group mechanisms, competition, conflict, etc. However, from a psychological point of view, of course, I'm a work and organizational psychologist, and based on that, I'm very much focused on solutions. And how can we explain if certain behaviors are undesirable? So what's their source? And if these behaviors are undesirable, is how does the human brain work? Can we have a workaround or not a workaround? Maybe another solution? Can we use those functions, the brain functions, for instance, and can we kind of create the conditions to change? It's very much, it's both in the functions of our hardware of the brain as well as the software, because without a hardware there's no software. And of course, you can only program if you have the right conditions, and that's the environment. So that is this mid-level theory, extended professional identity theory, was designed and first published in 2018 in the European Journal of Work and Organizational Psychology to explain whether people could create an additional social identity. An identification, because from a psychological point of view, this is a source of motivation. So if you have the social emotional connectedness with a certain identity group or social category, then in a certain context, it's context bound, then you will act accordingly. However, we have a problem. Houston, we have a problem. The problem is, of course, that we see in practice that a lot of things are not aligned. And from a psychological point of view, we have two major problems, which can also be major solutions. So the first problem that can become a solution is the principle of selective perception. And the selective perception is based on frame of reference. Frame of reference is the result of socialization, in other words, the programming of our hardware. And our brain has certain functions, like we see in fMRI studies. We see that our brain can recognize members of your own group, in-group members. For instance, the dorsomedial prefrontal cortex is activated only when you see in-group members. But there's more to it. It's not just belonging, it's much more. It's a source of motivation, and inherently based on the definition of motivation is that this is goal-directed behavior, which is driven by emotion as well. So if you look at some of the approaches were much based on only a couple of identity theories, combination of a couple of identity theories, but we have it's a bit more complex than a couple of theories. We want so we have those two problems. We have the selective perception, which is a problem when you think that thinking differently, having a different perspective, might be bad, might be incorrect. So, and from a psychological point of view, conflict is not acting like a silverback gorilla. It can also be very, very civilized or look very civilized. But at the same time, people representing certain professional groups might think that it's about right or wrong. And of course, and if you look at this logically, it's not logical. Because why do we have professional training? Why are you a nurse? Why are you a doctor? Why are you a physiotherapist or whatever you are trained for? You are trained for a purpose. Everybody has a purpose. So this also means that because of the socialization process, or mostly also because of your field of expertise, you will look at the world differently. So if we look at selective perception, we look at the hardware, you see that from a psychological point of view, you are surrounded by an environment that is not necessarily context yet. It becomes context when a selection of stimuli and the environment is filled with a large collection of stimuli is actually meaningful for you. And we learned this. So, and this is very important because that's where selective perception comes in, because you can see what I do not. You will, what is salient to you is not salient to me, because we have different professional groups and different frame of reference, and therefore different selective perception. And because you think there's a good reason why you needed this training and has become what you have become, then your professional identity also determines what you think is important. And therefore, based on this selective perception, this frame of reference, you will have certain priorities. So far, so good, until you meet people who, of course, will have another selective perception. And if you look at the same situation, this is problematic, especially because our brain is wired to see discrepancies. And quite often, seeing a discrepancy is not good. And therefore, quite often, we feel tension. And even to a degree that when you're not part of my group, the amygdala is activated in the brain, and this is alarm. An alarm is detected because you do not agree with me. And in the same situation, you feel responsible. Everybody feels responsible, but some people have more power than others. So then you have another problem. It's not just about selective perception, which is actually an advantage because everybody has if you are together, you have like a 360 degrees with regard to this situation. Nobody sees the same thing. Nobody is better. Everybody has its perspective and its function. So to overcome that. So that's one problem. The second problem is we're not part of the same group. And if we are not part of the same group, what happens? We see those brain structures function indeed, and especially also when we find out that we are not on the same level or do not seem, it's just a perception. It's a perception whether or not we are on the same level. If you have a different way of looking at things, that's a good thing. You can share, you can inform. This is what interprofessional collaboration is all about. But then the downside is there's kind of a contradiction in terminus, because please be different if you see professional groups as part of a toolbox. And if you have a complex project you want to build. You want to build a house, for instance, a hammer will not be enough. A saw will not be enough. So all those separate tools are not enough. And that is kind of what defines complexity. You need information. You need those perspectives. We need each other. But this is not how the brain works. The brain sees differences. And those differences, if they do not seem to align, you have psychological conflict. If you have psychological conflict, and depending on what you have learned, you will act accordingly, try to solve this conflict in whatever way, and there's more than one way. If there are people who have more power than others, then they will prioritize their focus above others. So then power becomes a problem. And the biggest problem is being part of the group or not, which is actually very normal. You are or are not part of the group. And according to a study of Heise et al. In 2015, we have like many hundreds of social identities. Very small and insignificant, or very big. Some of them are parallel. They never meet because they're context bound, and that context never overlaps maybe. So that's not a problem. If they do overlap, you cannot explain this by social identity theory, because these are intrapersonal identity processes. So then you have a problem. We don't understand. So how to deal with that? So now it becomes more complex. Okay, we know that people, if they have different opinions, this might become competitive. This might even turn into a conflict, even though we're just doing what we have learned to do. And what you learn is what you get. But that is isolated learning. This is isolated identification processes. So that is problematic. Social identity theory cannot explain that. Now you need to look at another tradition, which was also described in 2000 in a chapter of Stetzenberg, for instance. That is very strange that there are actually two identity traditions within psychology that are complementary but never meet. Never. And that is the intrapersonal focus, the intrapersonal approach of identity. Identity theory, which is completely different from social identity theory because that's between groups. So it's very logical to bridge those two because it's not or, it's and. So what's interesting about identity theory, what is not cannot be told by social identity theory, is that we have sometimes overlapping context. In other words, we have an environment where we can both recognize certain stimuli as meaningful to us. We have learned this. Some of those meaningful stimuli are actually related to one or more social identities, and those we are named identity triggers. So identity triggers, every social identity is activated by meaningful cues, meaningful stimuli within an environment. So it can happen that sometimes an environment contains more than one type of identity trigger. And then it activates a social identity is related to your self-concept that can be interpersonally conflicting. And this is quite often where we refer to inner conflict. This cannot be explained by social identity theory. What then a normal mechanism is to deal with this is referred to as identity hierarchy. An identity hierarchy is kind of a reciprocity between two things. One, it is the importance of the social identity activated. So if you have two social identities and one of them is emotionally more significant to you than another, that's completely subjective, then you know what happens. You make a choice. There is no motivation without emotion. So, but then it's a bit more complex. It's not difficult, but it is more complex because there's a reason why you are activated. There's a reason why you have to choose, and that's the identity trigger. So the identity trigger itself, as you recognize this, for instance, the salience network in the brain is responsible for this. Then you look at the environment, you see something, and then, okay, is it important enough? So you also assess. So it's a bit more, of course, more complex. But with regard to identity hierarchy, we have a new challenge. So that cannot be explained by social identity theory. That can be explained to a certain degree by identity theory. But identity theory itself cannot directly explain certain behaviors or how social identification becomes, real. So you need other theories to explain that. So with regard to that, to the identity theory, if there's a competition, an intrapersonal competition between identities, then it is because they conflict. So the answer logically would be that if you want to solve that problem, it should be solved by making something that is complementary. So only because you don't want to battle yourself. uh, uh, yes. So that is solved by, as long as so you can have, if you look at another theory to explain how you only not only have parallel social identities, but you also have superordinate and subordinate social identities within you. This is explained by another theory. This is explained by self-categorization theory of Turner from 1987. So if you go back and you know, then you combine this, then you know that if it is complementary, it should be able to coexist simultaneously, knowing that identity is context bound and context can overlap, and therefore you can have several different kinds of identity triggers simultaneously in your environment. And you can also learn this. So sometimes you don't know. We see this in the study with regard to to considering malnutrition and sarcopenia as a shared problem domain among dietitians and physiotherapists. And we see something that kind of as theorized, as expected. We see that the shared problem domain is saying, yes, it's mine and it's yours, which is, of course, very much related to shared social identity in that case, if we talk about interprofessional identity. However, if a certain situation is irrelevant for your professional identity, why should you work together? You don't. So there's a hierarchical or a kind of a sequence in identity triggers. You have your professional identity because you should be here. You should work together. But then you have an extension, therefore extended professional identity. Yes, you have an extension. You have an extension because it's still the professional context, but it's interprofessional. So you have an extension of the context. You have an extension of your identities with an additional identity. However, they cannot be the same social construct. Because if you fuse those social constructs, then you have another problem. Because your professional identity is very important because it's a source of motivation, which is very specific. And this is why you want to act accordingly. And this is why you are valuable to the team. So without a toolbox, there's no house to build. So this is a contradiction. The only way to solve that is to have a coexisting social identity. And therefore, this should be, you must be able to confirm this. Yeah, well, it's quite a lot, perhaps, but I told you it is complex. There's more, of course, because if you have a social identity, if you look at the first definition of a social identity was introduced by Teifel in 1978. And in 2004, Cameron investigated or published a study where he investigated whether based on the definition of Teifel, any kind of identity group would have the same dimensional structure. Which one would be statistically the best description? And he found out that the best description was statistically based, no matter what kind of identity group you're talking about. Can even be an identity group of volunteers, social identity group. It doesn't matter. They have the same structure. Of course, one study is no study. So Upston White in 2005 replicated this, which is very promising. And if a social identity, like an interprofessional identity, would be possible, humanly possible, then it's also very important that you can test its propositions. So the proposition of three-dimensionality was also tested with confirmatory factor analysis. first in the Netherlands and other countries. We also confirmed this, and which is also, of course, promising because people are people. It doesn't matter who you are. So you should, if it is based on the universal human brain functions, then the only thing that makes us different is not the functions of the brain, is not the software in this case. It is those typical things, the belongings, the different, what makes you unique. Of course, everybody is unique, even on the basis of your social identities, because we don't have the social identities. Even if we have the same profession, we don't have exactly the same identities. We don't. Like the study of Heise et al. In 2015. So then it's we have confirmed this three-dimensionality, which is actually not surprising. We have confirmed this also in Lithuania. We have recently confirmed this in Norway. It's confirmed in Germany. We have data that are not published yet, but then we have confirmed it statistically in Switzerland, in Austria. We have confirmed this in Turkey, in Indonesia. There are more versions coming up. We have found, this is also not published yet, but we have found measurement invariance, which means that it doesn't matter what country you live in, you have the same findings psychometrically. So the scale, if you like weigh, if you want to weigh something, the scale measures the same thing, should measure the same phenomena wherever you are. So the phenomena is the same, the magnitude is the difference, and the magnitude depends on the environment you're in. So that is that's very important. Besides the three-factor model of social identity as introduced by Cameron in 2004, which is also being replicated specifically to this kind of social identity, interprofessional identity, it's still not enough to explain everything, because you need additional theoretical propositions. You also need to know, and there's still, and still, besides those theoretical propositions, there are a lot of questions, because it's quite complex. So it keeps on going. There's a lot of things we don't know. But another thing is, and this is also the difference with other measurement instruments and with other theories, because every measurement instrument is an operationalization of the theory that's behind it. So every theory, of course, I'm very much a Karl Popper fan with regard to scientific philosophy, that it should be verifiable, it should be falsifiable. So you need very specific theoretical propositions of which you can derive hypotheses, and then you can test those hypotheses. There's another. So the difference is, first of all, if you look at identity instruments, of course you need to replicate those. You need to replicate their psychometric qualities. You need to confirm predictive validity after you have confirmed construct validity, constant internal consistency also of the subscales. This is not happening. This is not happening for every scale. And also, for instance, we have, there are two studies. I always say one study is no study. It's promising, but it's you have to replicate. We don't want replication crisis. So if the correlation, you need, and of course every cutoff value is arbitrary, but you need a correlational cutoff value to a certain degree when you compare instruments. So if you think that I don't know if in the Dutch it's we call meetpretentie. I'm not sure if that's also the English word. And pretension. I don't know. Anyway, in the Netherlands, no.
No.
So, okay, well, if you, it's like this is what this instrument's supposed to measure. So it's like the measurement the aim of the measurement instrument. So if you look at the measurement instrument, and both say this will predict interprofessional collaboration. So extended professional identity theory has extended professional identity scale that is based on the positions of extended professional identity theory. And then you also have other scales with regard to identity. There are certain ideas about identity, but for instance, you have scales where you have attitude as an identity dimension. Well, from a psychological point of view, attitude is not an identity dimension. It's a positive or negative evaluation of an entity, and it's not stable. So every time you have a new experience, process, person, group, whatever entity, it can turn out differently. But that's why the dimensions of identification are quite different. And you can also not you cannot collapse different social constructs into one. Because how would you predict still very profession-specific behaviors? You cannot. So that is problematic. So we found in 2 studies, indeed, with regard to those different approaches to identity, very low, too low correlations. So you need large correlations to really say, okay, this is measuring the same construct. So even though it might change, the index might have another value, show another value. It doesn't mean that even though both things are changed, the outcomes of the scales after an intervention, it doesn't mean they measure the same thing. Because if they do, they should have a very high correlation. So other identity measures do not correlate, and that can also easily be explained. It has a completely different look. For instance, one of them is where belonging, so professional belonging and interprofessional belonging are part of the same index. So based on the theoretical propositions of extended professional identity theory, this would be impossible. But there's another problem. Another problem is that how can you predict specific behaviors? If interprofessional collaboration is something that you can define, if it even though we have different ways, different habits, different cultures, it is about leveraging each other's perspectives, priorities, expertise. It is overcoming blind spots because you cannot see it all because you have selective perception. Then the measurement instrument should predict this. So just saying, having a subscale saying, I think interprofessionally will not be enough, will not be sufficiently. It should be, so the cognitions should be related to the actions. And in order to do that, this is also explained by another theory, and that is congruence behavior, identity behavior congruence theory. So you need to pull that in into the mid-level theory, and then you can specific knowing what the definition is of a motivation. You know that you need an emotional part of it, otherwise there's no drive. But if you're not specific with regard to the goal-oriented behavior as is inherently related to the definition of motivation, then you have another problem. You cannot predict any behavior that is aligned to that. You are a headless chicken. Yeah, yeah, you're just a headless chicken. So you just have a lot of energy, but you don't know where you're going. So that's problematic. So you need this. You need to be specific. So then you can compare scales. If you compare several scales with regard to identity as related to interprofessional collaboration, then look whether or not it is measuring a headless chicken. uh, um, so there is, and there's a bit more, but that's the last thing. And maybe because I told you, I warned you, it's a bit complex.
It's complex.
It is, but it is understandable. It is logic. It can be replicated, but it is complex. Maybe there are two more things, and then well, probably more, but the most important things are that if you build a house, if you look at the metaphor of the house, the building ground is not the house. But without the building ground, without a ground to build on, there is no way, or very difficult at least, to build a house. So theoretically, or also from a psychological point of view, an identity group is a group. A group, whether or not something is a group, is a perception. Whether or not something is there's a perception, it's an ability of your brain. And this is explained by entitativity theory of Campbell from 1958. And follow-up studies also from Blanchard et al. In 2020, but there are also other studies to mention, but she also confirmed, I don't know if it's he or she, I think it's a she, Dr. Blanchard, who confirmed the construct validity of entitativity, which is the perception whether a group can be perceived as a social entity or social unity, and antecedents. And the antecedents are like symptoms or indicators. So people look at those, how people behave. And this has two things. One, and this is from cross-cultural psychology. There's a study, very interesting study from 2017 et al. That studied one of those antecedents, like proxemic behaviors, which is very much related to the human, to how humans function. You can even pinpoint the neurological networks responsible for this and the regions within the brain. We dislike strangers to come too close, so you keep your distance. Strangers, you always keep your distance. There is no difference with regard to this if you compare any human being. We especially know specifically of 42 countries that this is ordinal, always the same. However, there are cultural variations. So it's always true that we feel more distance to stranger, but it's also true that some cultures, people become more close more easily. And this is why we also observe and interpret behaviors, because they are stimuli. We observe, they are environment, therefore they're stimuli. We observe those stimuli. The stimuli have meaning. They have cultural meaning, and therefore, but there are a lot of questions that we still have to answer with regard to that. So that's a kind of, and there's maybe one more thing. If you and that is very promising. If you have a stable internalized motivation, and you can create within a target population a critical mass of 25%, according to a study of Santola of 2018, Santola et al. If you have that critical mass, sometimes certain target populations have a much stronger social history or sociological history, then it's more difficult to change. However, it's always about 25%, maybe a bit more, if you have a minority, which is psychologically not a minority, because in the target population, there are always smaller groups. And then you have critical mass. If people are very motivated, or in other words, this is theoretically not tested with regard to interprofessional identity. But if you want to change interprofessional identity culture, then it's based on how people are motivated, how people think, what people do. That is, from a psychological point of view, is what culture is all about. If you can, and interprofessional education is a very important tool for this, because there you have the full focus to systematically socialize people, to build a stronger interprofessional identity. Then you can create critical mass of at least 25%. And then you have an acceleration of a shift in social conventions.
So make sure I'm understanding this right. So in the work that we're doing in IPE, we're trying to create that critical mass of people who see themselves as interprofessional healthcare professionals, so we could reach that 25 or whatever percent, and that's going to shift the culture within the practice. Like, I'm thinking theory practice gap here.
Yeah.
Am I tracking? Okay.
Yeah. And it this aligns, but it's because of the complexity, we did not have the time since 2020 to test it all, because we can measure it since 2020. And even though it's now very fast, there, because of international cross-culture research, we accelerate what we know, but still there are a lot of questions. So theoretically, what makes interprofessional education even more important is that research on one of its dimensions, identity dimensions, interprofessional commitment, is an identity dimension of interprofessional identity. If this interprofessional commitment is directly related to the phenomenon of a specific kind of commitment, which is referred to as effective commitment. Effective commitment becomes more stable after repetition. So you need long-term strategies in IPE to make that happen, because the stronger effective commitment is, and there are numerous studies that support this. There's a lot of empirical support for that. So it should work on interprofessional identity just as much. If you look at all the other evidence, if we have IPE as a structural long-term strategy, you can build very stable, resilient motivation towards interprofessional collaboration. And there is no way where it can be as fast and systematically and goal-directed as with IPE.
Wow. Excellent.
That's hopeful.
It is hopeful, and it's inspiring, because it's for me personally inspiring, because it makes me kind of recommit to the mindset that the IPE that I'm providing at Maine College of Health Professions, it's not a one and done, check a box. It needs to be longitudinal, meaningful, and kind of try to help students think of themselves as part of that, as an interprofessional healthcare professional, rather than, or in addition to, or inclusive of their professional focus, right? Their professional lens. I'm not articulating it very well, because my mind is humming from everything that you just said. And now I have to, the reference list that you gave while you were talking, writing down all these references. I need to go look at these studies. So thank you for that.
Thank you for joining us for part 1 of our conversation with Dr. Jaap Reinders. We explored how identity and context shape collaboration, and why different professions can genuinely see different priorities. In part 2, we move into what this means in practice and what it can look like to build stronger interprofessional learning cultures over time. We hope you can join us.
Thanks for joining us on this journey to better interprofessional education and collaboration. If you found today's conversation valuable, please like, subscribe, and share the episode with colleagues. Together, we can shape better practice through connection and conversation.